What if an AI could look at a cancer pathology slide and actually understand the clinical language surrounding it? That's what makes PRISM2 so interesting.
And no, it's not an AI doctor.
But the way it's being trained could change medical AI. Traditional pathology AI usually works like this. Give the model a tissue image, train it to recognize a specific pattern, cancer or no cancer, tumor type A or tumor type B.
Useful, but narrow.
PRISM2 takes a different approach. Researchers trained it using approximately 2.3 million whole slide pathology images, representing more than 685,000 specimens, paired with clinical diagnostic reports. Then they generated around 14 million question and answer examples from those reports. Think about what that means. The model isn't just learning, this is what cancer looks like. It's learning, this is what cancer looks like, and this is how clinicians describe what they're seeing. That connection is huge, because a pathologist doesn't just stare at a slide and say,
"Yep, purple blobs."
They look for morphology, patterns, structures, and context, and then translate those observations into clinical language. PRISM2 is trying to build that bridge between vision and clinical language, and here's the really interesting part. The model can be prompted with certain pathology questions and perform zero-shot classification, meaning you don't necessarily need to train a completely separate classifier for every new question. That's the foundation model idea. One powerful model, multiple pathology tasks, natural language interaction. But here's where the hype needs to stop. PRISM2 is a research model. It is not an autonomous pathologist. It is not approved to diagnose patients, and its outputs can be wrong, so the real breakthrough isn't AI is replacing doctors.
That's lazy.
The real story is that pathology AI is moving from recognizing images to understanding whole slides to connecting visual evidence with clinical language, and the logical next step is fascinating. Pathology slides, plus patient history, plus previous reports, plus molecular data, plus medical literature, all working together inside one AI-assisted clinical system. The pathologist doesn't disappear. Instead, the machine becomes the ridiculously fast research assistant sitting next to them. And that could be far more powerful than simply trying to replace the human. Would you trust an AI like PRISM2 as a second opinion on a pathology slide? Tell me in the comments.